everyone, greetings of the day. I'm Priyanjali from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mycosis are diseases caused by a fungus, which is yeast or mold. Mild fungal skin infections can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Shefali Saini, live from Mumbai, to enlighten us on the topic of fungal infection. Dr. Shefali Saini is a MD dermatology at KEM Hospital Mumbai, MRCP UK, SCE Dermatology UK. Her specializations are dermatologist, hair transplant surgeon, aesthetic physician. She has over 10 years of experience in this field, and today she has joined us in this live. A very warm welcome to you, doctor. As mentioned already, we are going to talk about fungal infection. The first question for today is, doctor, कोई भी ऐसा condition हो, the main issue is कि उसे हम identify कैसे करें. तो आइडेंटिफाई कैसे करेंगे डॉक्टर फंगल इन्फेक्शन को अर्ली स्टेज कैसा दिखता है.
Hello, good afternoon, and thank you for having me. I think also given the current weather and the couple of months where it is, I think sultry, humid, it rains heavily. So this topic becomes
Mm-hmm.
pretty relevant. How do
Right.
we diagnose fungal infections? When should it ring a bell for the patient that okay, I need to seek a dermatologist's opinion and start myself on medication fast? So often जब हम fungal infections की बात करते हैं, they are often intensely itchy, right? And they more often than not, start affecting the skin fold areas. वो भले ही आपके axillary folds हैं, groin folds हैं. For women, it may happen under the breast because that's again a skin fold. It may happen on your
Mm-hmm.
buttocks, which are constantly covered areas. So intensely itchy rash, often looking like rings. तो हम इसको कई बार layman language may people know it as ringworms because they often appear as little rings which keep spreading and coalescing with your surrounding rings, so it looks like that. Often it can look very scaly where the skin can look like it's exfoliating on the surface and may appear very red, or sometimes of course in brown skin individuals it can also look pretty dark, but I would definitely say looks like rings, intensely itchy, happening in the folds of the body, should really raise an alarm for a fungal infection.
Right. Now, doctor, once we identify the fungal infection, what should be the first step? Because we often tend to try out the things which are around us whenever we see such changes on our skin. जो भी आसपास है उसे लगा लिया. आजकल we know antiseptic cream सबसे सबसे ज्यादा हम उन सारी क्रीम पे निर्भर करते हैं घर पे just to get an immediate relief. What is the first step one should take in such case?
I think the first step one should take is try to not treat it yourself, because, as you likely said, by the time the patient reaches us, already months of home care, months of home remedies. Yeah, you go to your nearby pharmacy guy and he'll hand you over a cream, which is more often than not a topical steroid. So I think when it comes
Mm-hmm.
to fungal infections, because it's such a day to day use layman term, अच्छा ringworm हो गया, creams ले आएंगे ठीक हो जाएगा kind of a concept. But what the patient eventually ends up doing is start using steroids, and under the cover of steroids, of course, patient को initially लगा के खुजली कम हो गई, symptoms कम हो गए, the patients do feel better. But in the longer run, the skin damage has happened. You start seeing that wrinkly appearance of skin, and the fungus has just spread because under cover of steroids your fungus is going to increase. So first thing,
Right.
yes, do not self treat. The moment you feel that yes, something's happening, like I said, in those kind of areas, itchy rash, consult a dermatologist. Let them physically assess you and start you on antifungal medication, because antifungal medication is the only way to effectively treat fungus. And of
Right.
course, along with medication, a little bit of lifestyle modification, especially in humid areas or during the rainy season, like right now. make sure other members of the family are also checked for a similar rash. They may or may not have
Mm-hmm.
itching at an early stage, because it's like a ping pong infection, keeps going from one to you to others, sort of a scenario. And make sure your clothing is, starting to be washed separately. Make sure you're wearing absolutely dry clothes. If they're not drying in the sultry weather, make sure you're ironing them and wearing them. Make sure your undergarments are changed quite frequently. So start instituting these lifestyle changes, and then yes, readily start on medications that your dermatologist recommends.
Right. Now, as you clearly mentioned, doctor, fungal infections are contagious. Now, doctor, does different areas, I mean, fungal infection in different area has different causes behind it, or the causes are almost nearly the same?
In terms of I mean, whether it happens on your feet, where it's called an athlete's foot, because in athletes, they wear footwear and it's kept covered. Whether it is happening
Mm-hmm.
in your hands, whether it's happening, like I said, in your body folds, the causative organism remains a fungus or a yeast. Um, the particular subtype of the fungus may change. So we have something like a subspecies called Trichophyton rubrum or Trichophyton mentagrophytes. So the subspecies may differ, but in India, of course, rubrum and mentagrophytes remains like the causative organism for the vast majority of infections. Sometimes in some people, less often, it can be a candidal or a yeast infection. Looks slightly different from how a tinea infection or a particular ringworm infection looks. But I think the good thing is that whether it's a tinea infection, whether it's a candidal or a yeast infection, they are all more or less sensitive to the same class of drugs. So we can start those drugs and start seeing
Mm-hmm.
the improvement in patients.
Okay. Now coming to one particular kind of fungal infection, which we normally tend to see within the housewife. So, doctor, the housemaker, they tend to be always in contact with water. So I have seen a lot of women suffering from the same fungal infection around the nails. Also, such fungal infections are seen to be a little more stubborn than the rest. Uh, Tell us, doctor, how do we treat this kind of fungal infection? And for all those women who are worried कि ये तो ठीक नहीं होने वाला है, it's gonna be the same forever. So, any answer or anything you would want to say to those women?
Yeah, I mean, rightly, very, very rightly pointed out. Of course, women in the kitchen, laundry, cleaning work, etc. So we
Mm-hmm.
often see fungal infections enter around your fingernails, start affecting your
Mm-hmm.
toenails. The nails start looking, broken at places, or they may start appearing yellowish or greenish discoloration. The nail plate itself becomes crumbly. The whole texture of the nail changes. You may see thickening of the nail, under the nail, you may see that there's thickening building up. So, all of these are subtle ways of the patient realizing that, okay, I may have contracted a fungal infection. Interestingly, for fungal infections on the feet and the hands, the fungus takes the longest time to go. Now, ideally, अगर आपके
Mm-hmm.
पैर में, अगर आपके toenails में fungal infections set in हो रहे हैं, it may take anywhere up to 9 to 12 months. Firstly, for the fungus to kill, and secondly, for your nail plate to start growing as your former fine, the absolutely okay looking nail plate. तो almost एक
Mm-hmm.
साल लगता है. When it comes to fingernails, when it comes to our hands, it may still take around 6 to 9 months. So a slightly shorter time than your toenails, but then again, it requires months of treatment. At the same time, like I said, lifestyle modification. So whether you are a homemaker, whether you are somebody whose profession involves constant use of water, whether it is hairdressers, butchers, vegetable vendors, constant
Mm-hmm.
use of water. Definitely one thing, yes, start wearing heavy duty PVC gloves which come all the way to your elbow. Now I've seen patients wearing those, surgical latex gloves which are barely up until your mid forearm, and वो तो भी आप काम कर रहे हो, पानी घुस गया, वो उन gloves का कुछ ज्यादा काम होता नहीं है. तो मेक श्योर, आई थिंक ये
Right.
बहुत ही पर्टिनेंट पॉइंट है कि हेवी ड्यूटी पीवीसी gloves आप पहन रहे हैं which are running right up to your elbows, so they protect you. They are a good defense against constant wetness. And one thing, yes, I tell patients कि जब भी kitchen work है या कुछ है, where you know अच्छा ठीक है थोड़ा बहुत मेरा water exposure होने वाला है, start occluding यहाँ का जो आपका nail का structure है, there is skin folds all around your nails, start occluding that with a little thick Vaseline, because Vaseline will act as a
Mm,
water repellent. It won't let water
right.
keep continually, building in those areas. So I think ये subtle lifestyle modifications help करते हैं. इस दौरान आप consult your dermatologist, get started on medications, and be prepared to be on medications for a longer period of time.
Right, right. So people who are losing hope, guys, maybe you are not continuing or you are not being consistent in your life. Please, please do not lose contact with your expert, whomever you are visiting. Please make sure you are visiting your expert, even though if you're not seeing your results. Make sure you take a suggestion from your expert. Now, moving ahead, doctor, coming to treatment. What are the treatment options which are currently available to treat fungal infection?
So treatment options are plenty. One thing, yes, that we need to be, conscious of both as patient and the doctor. That जैसे हम बात करते हैं एंटीबायोटिक रेजिस्टेंस की आजकल कि इतने सालों से हम एंटीबायोटिक्स दे रहे हैं तो now the bacteria has become smart to the antibiotic. A similar trend is also happening in India where the fungus has started outsmarting your antifungal medications, right? Because
Mm-hmm.
हम सालों से now these medications were discovered maybe almost like half a century back, and some form of it has been in constant use. So definitely some fungal species have started outsmarting the drugs, which further gives us the important message that beyond treatment for a long time for entire fungus to go, otherwise the fungal infections keep coming back. So some common
Mm-hmm.
drug classes which are called the azole groups are
Mm-hmm.
available as tablet form, as topical form, whether it is something called as itraconazole or fluconazole. Of course, now there are further refinements of azoles available as
Right,
creams,
right,
oxyconazole,
right.
bifonazole. या हम टबिनोफिन देते हैं, ग्रिसियोफल्विन नाम के ड्रग्स हम देते हैं. There are excellent antifungals available, provided they are given for an adequate length of time.
राइट राइट नाउ बिकॉज हम इस बारे में बात कर रहे हैं डॉक्टर ये जो अजोल्स के बारे में हम बात कर रहे हैं रिसेंटली आई वाज अटेंडिंग अ सेमिनार जिसमें द डॉक्टर्स दे वर डिस्कसिंग कि धीरे धीरे ये अजोल्स के जो रेजिस्टेंस है ये समहाउ पेशेंट्स गेन कर रहे हैं वी समहाउ अभी कॉम्पोजिशन मेडिसिन हमारे पेशेंट्स को सजेस्ट कर रहे हैं कि सिर्फ ओजोल से काम नहीं होगा इसके साथ ये भी जरूरत है. Can you tell us the reason behind it, please, to our viewers?
So, I mean, the same thing, like I just spoke about. So,
Mm-hmm.
now, of course, whether it is antibacterials or antifungals, all these groups of medications have been in use for decades together now, right?
Right.
Yes, subtle modifications in the chemical structures keep happening, newer congeners of the drugs keep coming out, but at large, अगर आप किसी फंगस को एक दवाई से बम्बार्ड करके उसको मारना चाहते हो, फंगस भी स्मार्ट हो जाती है आफ्टर अ कपल ऑफ इयर्स
Mm,
कि ये दवाई ऐसे काम करती है, दिस इज हाउ इट इज मेंट टू किल मी. And then the fungus starts building mechanisms ki I need to be less susceptible to the drug. I need to build my
right.
defense mechanism ki mujh pe dawai kaam na kar paye. And I think this is
Mm,
not just in India, this is becoming a global issue. That is why correct diagnosis and using the correct class of drugs for the correct period of time becomes very, very important when it comes to
right.
doctors prescribing it for the correct situation, and for the
Right.
patient also to realize that you land up at a dermatologist's clinic and not some parallel medication. Please, this is again important to look at the degrees of your treating physician.
Right.
Dermatologist, yes, confirm that, visit them, they'll be the best people to help you out. Otherwise, yes, wrong medication, wrong indication, fungal resistance, and the fungus never gets treated. So I think, yeah, these are some of the reasons why we are facing more and more cases of fungal resistance now.
Right, exactly. I mean, I know a lot of people जिनको पता है फंगल इन्फेक्शन होने से कौन सी दवाई लेने की जरूरत पड़ती है. They know. They just go to the pharmacy and they ask, भैया ये वाला दवाई आप दे दो. That is not how you do it. That's what we are trying to spread today, guys. अगर कुछ भी समस्या हो आपके स्किन में, आई नो कि सब सोचते हैं कि डॉक्टर के पास जाएंगे, हैसल हो जाएगा, एक दवाई के साथ 3 दवाई और मिलेंगे, इतने सारे टेस्ट मिलेंगे, बट समहाउ इट्स फॉर यू. आप फ्यूचर में ये हैसल जो है ये आपका इंटू टू हो जाएगा. So just to avoid that hassle, I think you should always visit your nearest expert. Now coming back to the medications once again, doctor, antifungals. What if somebody is taking antifungals for a longer period of time? What can be the worst case scenario?
Worst case scenario for the patient. Now, of course, when we are starting out antifungals for patients, we make sure we have a detailed medical or surgical history of the patient. Of course, certain
Hmm.
groups of patients, especially two groups. One is geriatric
Hmm.
or older patients, I would say above the age of 50, 55. And second would
Hmm.
be pregnant women. And a third class
Hmm.
would, of course, be pediatric or the child age group. Definitely,
Hmm.
in these three classes, we have to be careful of the choice of antifungal that we are prescribing to the patient. Um, in older age group, yes, any existing heart disorders, rhythm disorders, lung disorders, or kidney disorders, we try to change. We try not to give itraconazole. We try to treat it with terbinafine or topical creams, or maybe a griseofulvin. Similarly, when it comes to women, a lot of drugs are considered category pregnancy category C or X, which means that we cannot, freely prescribe them in pregnancy. So, depending upon the trimester, depending upon the general health of the pregnant woman, we have to be careful again of the
Hmm.
choice we make in terms of prescribing drugs. And of course, when it comes to children, again, the dosages differ. Dosages have to be given as per the weight of the child. The choice of the antifungal that you use. Children often develop infections of the scalp, and in children, scalp infections are often more susceptible to griseofulvin than other groups of drugs. So then we make those
Right.
choices accordingly. And I think, yeah, these few scenarios we have to be careful about.
Right. Now, I would once again like to dive into the earlier question, doctor. We were talking about nails earlier. So tell us, we know by now that fungal infection is contagious. So are these nail fungal infections also contagious? I mean, if somebody is using their bare hands to feed the family, or somehow the nails are in contact with food, so or touch, say, can it also spread in such way?
I would say, of course, fungal infections that come and attack your skin or specifically attack your skin aren't
Mm-hmm.
really potent if they are eaten up, right? They need keratin on your
Mm-hmm.
skin, the protein keratin on your skin to thrive. The fungus eats the keratin, and that's how, these infections remain superficial. So often, if there is a cook who's cooking food and, you are kind of ingesting that food, I'd say ठीक है, you don't start getting systemic fungal infections, but definitely because, like I said, the same group of fungus is causing nail infections in the skin. So somebody with untreated, uncontrolled nail infections can definitely pass it on to skin infections in other people who are in contact. So I think,
Okay.
yeah, definitely another reason why they should be addressed and treated.
Right. Another thing nowadays we see a fascination for having nails extensions. So a lot of girls they visit the salon. Uh, can those tools which they use for extensions, can those tools also be a medium for the spread?
Yes, often they can be a reason for spread because, of course, they are washing the the
Hmm.
equipment when they are using it on multiple people. You don't know who was infected, or a little bit of infection in the nails, cross infection spreading to people. So I think that definitely, with the advent of too many nail procedures and nail getting your nails done or manicures, etc., definitely runs a risk of cross infection amongst people.
Right. So we are not saying we do not self care or do not self love, please make sure the person is sanitizing all those things. Not just those people, as doctor mentioned earlier, that in your family, in your household, if you see anybody suffering from the same, please make sure you're not washing all the clothes together, or you're not
Yes.
using the towel, the same towel, or the foam, or anything which comes into contact with the skin. Doctor will quickly take two questions from our viewers. The first question comes from Ahmed Khan, who asks, can it pass from the pet?
Yes, definitely. I think very, very pertinent question. Of course, when it comes to fungal infections of the pet, I wouldn't say they look or they're treated any differently. But yes, sometimes they are on more exposed areas of the body, say your hands, your feet, your legs, your forearms, rather than the quintessential areas like the flexure areas, groin, axilla, जो हम बात कर रहे थे. तो डेफिनेटली आपके पेट्स के इन्फेक्शंस भी ह्यूमंस में ट्रांसमिट होते हैं एंड ऑफन जब पेट इन्फेक्शंस ह्यूमंस में आते हैं दे आर ऑफन मोर इन्फ्लेमेटरी राइट दे विल बी मोर सिम्टोमेटिक आपकी इचिंग काफी सिवियर होगी you will see like a brighter redness a lot of redness and a swelling around your tinea infections and often yes these infections often take longer to treat and at the same time your pet also needs to be treated so I think
Mm,
otherwise, yes, the same groups of drugs. Sometimes you may require a longer course for the fungus to go completely. But yes, quite pertinent. These infections are on the rise because more and more people are becoming pet parents.
right. The next question, doctor, comes from Deepak Saxena, who asks, are all white patches in our mouth fungal infection?
Not really. Now, of course, the skin is one organ. It has limited ways to present a particular disease to you. When it comes to fungal infections, they can mimic a lot of diseases. That is why it's important for you to visit somebody who's trained to differentiate all diseases. When it comes to white spots, I wouldn't say particularly fungus would resemble a white spot, but definitely, sometimes we have to look out for conditions like eczemas, which are again itchy, dry skin. So they share a common symptom of itching. Eczemas can often happen in the same areas like your flexures, like your axilla, your groin again. Or some people with psoriasis, or some people with something like an intertrigo, which is like more of an irritant dermatitis. So I think these group of infections need to be differentiated because the management of all these conditions differs. So, kabhi kabhi to even as practitioners, we find it very difficult to the patient has taken multitudes of treatments and come to us with a very different looking rash. And then, yes, we have to be very careful whether we are dealing with a fungus, whether we are dealing with an eczema or a psoriasis, whether we are dealing with intertrigo, and then we cater to treatment
Mm,
accordingly.
right. Doctor, quickly one question, one another question. We know fungal infections are stubborn. They have a tendency of occurring again. So reoccurrences can be seen in such cases. We see a lot of women suffering from fungal infection in the vaginal area. It has been a constant issue, especially during this season. Can you please tell us any tips or tricks which women can take in, or the kind of treatments which are available? Can this be cured? Can the reoccurrence be stopped? Because I literally meet people who are worried regarding this issue. Also, any tips to deal with fungal infection during this season, the monsoon season?
Yes, definitely. I think again it's a very pertinent issue because getting repeated fungal infections for women in that area, especially for women in the childbearing age group, often undiagnosed infections continuing over months and years, often then eventually
Mm,
becomes a cause of infertility, right? So
right.
something like a PID or something developing in the woman. So definitely any sensation of itch or discomfort in that area, any foul smelling discharge from the vagina per se need to be investigated, need to be treated. Now, of course, there can be various reasons of why symptoms are happening there or what kind of a discharge it is. But yes, having said that, fungus does remain a very common cause and we do commonly treat for it. Sometimes we treat it as a blanket cover with maybe say an antibacterial and an antifungal together as part of NAPO guidelines sometimes. And of course, now, couple of things very important for women. Yes, make sure that you are keeping that area moisturized. Make sure that area is not washed with hot water. Start using cold water. You don't need vaginal douches and vaginal washes, etc., to really take care of intimate health there. That's also often a myth. A simple pH balanced cleanser, like an acidic pH of 5.5, a regular cleanser and cold clean water to wash that area is often good enough.
Mm-hmm.
Definitely, if you are somebody who's recurrently getting these infections despite treatment, you must check out your blood sugar levels. Sometimes an HbA1c test often helps us to gather information on how your sugar control has been over 3 months. So I think that I find pretty pertinent in some patients. And definitely, yes, especially in this weather, like I mentioned, the do's and don'ts: wash your clothing separately, do change your undergarments frequently. And I think all of these subtle changes, if your clothes are not drying, make sure they're ironed when you're wearing them. All of these
Right.
things kind of do play a significant role.
Right. So basically, what we have to try is stay away from moisture in our body. Try and keep your skin
Yes.
dry. Everyone. Right. Well, it was a wonderful session with you, doctor. We got to learn a lot from you today. Before
Thank you.
we take a leave, anything you would want to mention our viewers who has watched us so far?
I think keep a high watch. This is the weather to for fungal infections to be on the rise. Consult your dermatologist. Let them see what's happening. Be ready to be on antifungals for a fairly long period of time, because you don't
Mm,
want this kind of a cycle. And currently in India, fungal infections aren't being treated within a couple of days or a week, or
right.
sometimes even within a month. Be ready to be on drugs. Take care of your lifestyle modifications, and I think, yes, keep a high radar now that you know what are the symptoms for it. And yeah, we are there to help you out.
Well, that was the expert advice for today, and that was Dr. Shefali Saini for us. Thank you so much, doctor, for your valuable time. It has been a
Thank you
very
so much.
informative session for our viewers today, and we look forward to many more such sessions in coming time. Also,
Thank
thank you, viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Good day. Stay safe and stay healthy.